Professor of Evidence-Based Medicine at Oxford University, Carl Hennigan, and Dr. Tom Jefferson of the Cochrane Collaboration have carried out research into the basis on which we were all forced to wear face masks during the pandemic.
And they've published their research this morning. We're delighted to say they join us for an exclusive interview for GB News. Carl, Tom, welcome to you both. Tom, perhaps we can start with you. Obviously, during the pandemic, we were told, first of all, that face masks were a waste of time. Then they became so important that we were legally forced to wear them. So what's your research found?
Well, we looked at the UKHSA review. That's the predecessor of Public Health England, which the government provided as a basis in a parliamentary question, as the basis for mask mandates. The review contained 25 studies, 2 trials and 23 so-called observational studies, which is a lower level of evidence. And the main points are summarised and the details on our website, Trust the Evidence. So that's what we did, and we provide some main points and we provide details on all the studies included in this review. What we found was that the quality of the evidence was abysmal, and in fact 12 of the studies should not really have been included in the review because they don't compare masks with anything. They're non-comparative. They have a non-comparative design. So they can't really inform any policy. That's the bottom line, Philip.
And Carl, if I can bring you in here, I mean, it wasn't just the UKHSA who changed their view on masks, was it, during the World Health Organization, and this happened in other countries. So, I mean, is this something where the international community has some blame, or is this something specific to the UK Health Security Agency?
Well, there has been this flip-flop, if you like, in people's opinions, which occurred in about the first 2 months of the pandemic. From about March to May, many advisors flipped what they were saying. But I think it's important. What the evidence is about what UKHSA's job is to inform you as politicians so that you can make informed decisions. But when we look at this evidence, it's so poor quality, as Tom said. I'll just give you 3 egregious examples. One is it included a predatory journal. That's a journal that has no peer review in place, so it should never have been in there in the first place. It had populations that didn't even represent the people, like in Brazil. But third is, it had this phenomenon called cherry picking from the ONS data. Now, this is just like GCSE O-level questions. If I gave you a data set and said 6 of them showed mass work, and 6 showed they didn't, which one would you pick? Is it okay to just pick 1 2-week period and present that information to the public and to politicians? Well, that's what the ONS did, and that's what the UKHSA did. And it's completely unacceptable to do that, because when you're misinforming the debate and what we should do next. And then the second important issue is we've seen again this week, the UKHSA has done another review about FFP masks and N95, those ones that you see which have a much closer fitting on your face, and said there is no evidence whatsoever to inform their use in the community. And that, for general population and young people, is not an issue. But if you're at high risk, you really want an answer to this question, and you want to know, does it make a difference if I step out the house and there's been a complete lack of will to produce any evidence in this area?
So some of us thought that the evidence had changed, and that's why we were being told something else. So are you saying this self-selection, this cherry-picking, would you call it then tampering of information or the evidence? How would you phrase it?
I think tampering is a little bit. We have no evidence of that. Something happened during March, April, 2020, to cause this what I call a somersault. People completely changing its position, but the Cochrane review on physical interventions, that's just not masks, but also things like hand washing, distancing, and so on, all non-pharmaceutical interventions, has been running since 2007. And the conclusions of the 2020 review are exactly the same as the conclusions of the 2023 review, this fifth update. So there's nothing new in all this. What the new, one of the new characteristics of the situation we're in is government's refusal to fund any trials or any help or facilitate answering studies, relevant studies, good quality studies, well-designed studies to answer these very important public health questions. These are the use of these interventions has been general, has been global. So there's nothing more important than this.
Carl,
I can't think of anything.
I just wondered, I was struck by your point about the cherry picking of a fortnight's data out of a 6-month study. I mean, is there a suggestion perhaps here that, in effect, the UK HSA were coming under political pressure from the government to find reasons why face masks should be worn, and that, in effect, it wasn't the UK HSA who were informing government decision, it was the government perhaps trying to get the UK HSA to try and help support its decision?
I think this is going to be an important issue for the inquiry to look at. This is not the first time we've considered what we call retrofitting the evidence to the policy. You've made the policy, so then you look back in time and say, what evidence can we draw to us? It happened with the Masks in Schools review, very similar position. And we ended up saying, well, look, if this is what you're presenting to the minister, there's a key problem here because he's not being informed. Now, who's guiding that is an important question. I don't know the answer to that. But it's very clear early on there was a lot of poor quality evidence developed that then subsequently has gone into these reviews and has been used to retrofit, as I've said, to a policy to make it look as though the evidence was in place all along.
Carl Hennigan, Tom Jefferson, thank you so much indeed for joining us this morning and sharing this explosive research with us. We appreciate your time. It is quite unbelievable, isn't it, really?
Well, I think the cherry picking, that's why I was trying to get to the bottom. Was it tampering? No, it was cherry picking. But should you only take 2 weeks out of a 6-month or a longer period, you are distorting what it was. And as you said, were they saying they wanted you to wear masks at any cost? Therefore, they were finding the evidence to meet that. And I thought, what were the masks about? Were they about fear? Was it like a constant visible reminder that COVID was around? Did it need to protect you? But all of these questions need to be answered.
They do. We should make clear that we did actually ask the UK HSA if they wanted to come on the show to justify their policy on face masks and to respond to Carl Hennigan and Tom Jefferson's report. We haven't yet had a definitive response from them, but of course we will. If they do issue a statement or they do want to come on the show, we'll be very happy to share that with you so that you can hear their point of view as well. But I think that was certainly interesting.
An eye-opener.
An eye-opener on some of that evidence.